The meniscus is a special type of cartilage within the knee itself. It's a thickened fibrocartilage, which is like a cushion cartilage between the femur and the tibia. The knee is unique because it has two kinds of cartilage. There's a cartilage at the end of the bone that lines the edge, and then there's a meniscus cartilage that's actually between the bones as well. Meniscus injuries can present in various ways. There can be the acute traumatic way, which we see in many sports injuries. These athletes will cut or pivot, and you'll watch their knee give out, and the meniscus can get torn. Besides traumatic injuries, the injuries can also be more gradual in nature. As the knee does wear down, there's less space for the joint, and there's less of a trauma, and even normal activities can cause a wear or tearing of the meniscus as well. This is the most common question I get, whether we're going to repair or trim the meniscus out. And there's a lot of factors that go into that. The size of the meniscus, the blood supply to the meniscus, how much room is left inside the joint. When we're in surgery, we take all those factors into consideration. The most important part for us is to make sure that we leave as much meniscus behind as possible and to make sure it's stable and functional for the future. This video is an example of a meniscus repair. This patient has a very large meniscus tear. The meniscus is this cushion you're looking at between the femur and the tibia. And I'm pulling on this, and you can see how large that tear is. The whole thing is pulling all the way into the joint. So instead of removing this entire meniscus, we're going to sequentially put stitches in to secure it back to its rim. And this is what it looks like afterwards. So there's stitches holding the meniscus together. We're pulling and making sure it stays nice and stable to allow it to heal over the upcoming 4 months. This is an example of a meniscus tear where the tear itself is shredded in numerous small little pieces. These small little fragments are unstable, causing more damage to the joint, and these small little pieces end up getting trimmed or removed from the meniscus. The rehabilitation and therapy after treating the meniscus depends on what kind of surgery you underwent. Trimming the meniscus, or we call a meniscectomy, tends to be a fairly quick recovery. You can apply pressure right away. The rehabilitation physical therapy typically takes about 4 to 6 weeks for a full recovery, even to sports. The rehabilitation and therapy after meniscus repair is different than trimming your meniscus. If the tear is large enough for us to stitch back in place, you'll begin with a trial of immobilization or brace. You'll still begin therapy during that phase, but the full recovery can take up to 4 months for a full return back to sports.